Hello, my name is Jamie Gary. I am the owner of Upvision Consulting LLC, which is a full service legal nurse consulting firm. And we are the founder of the Attorneys Resource Conference, or as you're hearing it this year, ARC 2026. This conference will be taking place in Grand Rapids, Michigan, August 11 through 13, 2026. You will see a link above me and also a QR code down below. If you go to attorneysconference.com or you scan the QR code to get your registration in and guarantee your seat, you will not be disappointed with this conference. This conference is designed to improve your strategy in case litigation, improve your professional practice, and improve your ability to identify and mitigate risk. So today we are meeting with Dr. Amendola, and he will be joining us as a presenter in August. We are excited to welcome you, and I'd love to start with letting the audience know who you are, what you do, and what you do, I guess is the question. Who are you and what do you do?
Jamie, thanks very much. So I'm Mike Amendola. I am a vascular surgeon. I'm actually boarded in general and vascular surgery. I've been doing both to the greater extent vascular surgery since 2009. I am currently at the Central Virginia VA healthcare system, so I work for the federal system. We are a large 1A facility in Richmond, but we have a catchment area in parts of North Carolina, West Virginia, and lots of Virginia. I'm the division chief of vascular surgery. So vascular surgeons basically are the plumbers of the body. We take care of all the arteries and veins outside of your head and chest. And I've been doing that since 2011. I've been at the facility. I also run our vascular lab, and I am a full professor of surgery at Virginia Commonwealth University. So I oversee the training of medical students, general surgery residents, vascular fellows, vascular residents, as well as aligned or allied health professionals that rotate with us, including nurses, nurse practitioners. I've been in the legal space, medical legal review kind of space as an expert witness for about 5 years. Really enjoy the work. And because I'm an educator, that's what's kind of brought me to this conference. And I was given an advice to join this conference and give a abstract by one of my co-partners, Stephen Cohen, who's one of our general surgeons / colorectal surgeons in our practice. So that's kind of me in a nutshell. But generalized, I like to elevate education. So I've got additional training in education from Johns Hopkins. So I have a master's in medical education from there, also known as the MEHP. So that's kind of me in a nutshell.
That's wonderful. We're happy to hear that you referred to the conference and that it has made your docket for presentation. We're excited to welcome you. Give us a snapshot of your presentation, just briefly for the audience. What should they expect when they arrive to hear from you?
Yeah, so a lot of times in medical care and subsequently in legal action as it relates to medical care or surgical care, there are learners in the midst of that. So most of the time, the kind of conventional thinking is either medical students or residents. So I wanted to center a talk basically to say, hey, in 2026, this is what it looks like to be either a resident, a general surgery resident, or a surgical resident and a medical student. And oh yeah, by the way, this is kind of historically how residents have been handled and how commonly they are potentially named. But more importantly, what are the active issues within the educational environment, usually in academic or federal practices, that look at, okay, how involved was the resident? Was there any culpability of the resident's actions as it pertains to a treatment decision? And so to kind of bring up some of those issues, medical training and surgical training in particular in the United States, to a large degree is relatively unknown by the lay public. So that's kind of my kind of push is to say, okay, hey, this is how we train surgeons in 2026. This is historically where we've come from and where we're going. These are the ongoing issues. So part of that, part and parcel, is the workforce within healthcare systems, in particular academic healthcare systems, and how the residents play into that.
This will be a unique opportunity to get an insider view of that whole process. So tell me, what is the risk if we don't learn about this?
Well, I think for the attorneys attending, it's important to understand through the eyes of the resident or the learner exactly their view of the cases. And many times the truth is spoken as what's going on, usually through the most novice person in the room. And that's usually either a medical student or a resident that is taking care of that patient. The real issue, I think, is identifying some of the underlying kind of power discrepancies that we see in surgical education to say, okay, a resident is saying this and the attending is saying this. And that, what exactly is happening with the patient. So commonly when you review cases, I've found it's like a mystery till you get to the end. It's unlike a mystery in that it's not sequential in its activities within the medical chart, as we all know when we review cases, but it's pulling that kind of together and saying, okay, this is what I think happened to this patient. Oh yeah, by the way, the resident was, echoing this. And I'm going to have several examples of my talk where I've done reviewed cases, and these are the mitigating circumstance that have led kind of retaining attorneys to say, oh, I never even thought to look at when the resident put the note in versus when the attending put the note in, or that the resident never wrote a note and the attending wrote a note, or the resident ordered this and then it was canceled. So there's all these kind of examples that I think are kind of Easter eggs throughout a chart that have relevance as it pertains to the training of residents.
Mhm. So, as an attendee, how do you want me to feel, act, behave differently after I learn what you have to share?
Yeah, so I think general awareness of how we train surgeons, general awareness of what the work environment is for residents and medical students, more so for residents than it is for medical students, but also for the attendings that are taking care of these patients. Sometimes that is, I think, the most important thing. So awareness of the environment, but more importantly, messaging and issues that come up that are not overtly obvious unless you're a surgical educator and looking at charts that way or cases that way. So I've been educating in medical education since 2009. And then I've been a resident. I was a resident from 2002 to 2009, and then before that, a medical student. So I've been in all aspects of kind of training and education. So awareness, I think, is the most important concept for the person listening that is going to walk away. And I hope with some cases that it's entertaining to those listening as well.
I think it may be, as a registered nurse, if I might add, working alongside residents throughout my career, I'm excited even to learn a little bit more about their training.
Yeah,
I think that has the potential for some great impact on betterment of collaborative care as
yeah,
well.
absolutely.
So
And
I'm
so,
excited to hear
yes.
about that.
Yeah, and I think you're hitting on a very key point, which is sometimes there is a very interesting communication channel between nursing and learners, residents, usually that are in the hospital taking care of patients. And then the real question is, where is the adult? The adult's not necessarily in the room or in the hospital, but are they understanding what's going on? So I
Right.
think leveling kind of a communication pattern with residents, but also with attending. So commonly in our practice, our nursing command and our nursing leadership, as well as our rank and file nurses, know if they're not getting the appropriate escalation from residents, they can call us directly. That it does not occur in all the institutions, and it's important to understand that there is sometimes a power differential between residents and attendings. And nurses sometimes, when they're aggressive, providing good care, and they see their patients not being tended to, will push that and say, hey, you're not responding to me. I need to go to a higher kind of authority. So that's a kind of another component of the need for communication within the environment.
Sure. So what is something that you believe most people misunderstand about this topic?
That there is the resident I think a lot of people who are not involved in medical education or kind of in the lay public will basically think that a medical student coming out of medical school is a fully trained doctor, and they're not. They're in the midst of being trained, and that they have enough clairvoyance and training as a surgeon. And there's a variety of different, there's a gradient of responsibility that occurs with our residents as they go along. So there's some real nuanced components of clinical thinking and reacting to situations based on more senior residents versus junior residents.
Mhm.
Whereas I think there's a perception that, oh, a resident, either the first or the fifth year, they're going to both react to something the same way, which is absolutely positively false. So there's a
Mhm.
lot more gradient in terms of decision making, thinking about a problem, and then acting on it and doing the appropriate things and communicating that up the chain. So that's, I think, another component. And that is now kind of changed over time. Our surgical education environment now is much more collaborative in nature with attending surgeons like myself than what it was when I was a trainee.
That's great. So, who do you believe should be in the room to hear your presentation?
I think anyone who's kind of involved in med mal or expert witness work who does review of cases, the physicians that are in the room that are maybe even outside of the surgical specialty, but I think also nurses to look for subtle things and subtle points within cases, but also attorneys to understand that's, figuring out, okay, did the resident kind of do it? What's kind of, where is the resident in this mix? And that's, so I've kind of set up a kind of a broad based discussion, and I've kind of added examples that I think every kind of layer of person listening will get something from that.
Mhm.
So that's what I'm taking actually a significant amount of time to put this talk together with that in mind, because
Good.
it's something you have to think about as you go along. I also do a historical review of kind of where the total number of cases that are involved with residents in the legal, in the kind of the legal realm, what's currently published as it pertains to that. And then I also touch, if you have any interest that or people listening, is the historical. Where did we start from? Why do we call physicians that are being trained as surgeons, or quite frankly, in any specialty, a resident? Where does that come from? And then other hints like where the term rounds comes from. I'll show you some historical things that kind of pull those things together. So I think even if you have minimal interest in this topic, you might learn something historic about the way that medicine works in the United States, especially training people.
That's great. I think that's important, especially in today's society. So, thinking about August, what are you most excited about in attending ARC 2026?
So I've never been to where you're part of the country, so I'm looking forward to that. I'm looking forward to the dynamic environment, and I'm looking forward to the interface. I like speaking to people from a variety of different backgrounds because it pushes me to think more about where I am and how what my perceptions are, and more importantly, what my biases are. So that's what I'm looking forward to, is the dynamic on the ground, but also to visit a part of the country I've never been to before.
It's a beautiful part of the country. So thank you, Dr. Amendola, for participating in ARC 2026. For those of you that are watching, thank you for taking the time to watch the video. Please go to attorneysconference.com or just click on the QR code to get your seat. We would love to fill the seats for this presentation. I think there will be significant value for attorneys, legal nurses, experts, and others that just have a basic interest in learning a little bit more about how residents are trained. So thank you very much, and we wish you a wonderful day.
Have a good one. Thanks.